6. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life, here on WWNN 95.3 FM and 1470 AM, so you can get us at both of those places. And we're also on All County Healthcare's Facebook page as well. Thank you. And then allcountyhealthcare.com is where you can find all the radio shows that we're doing. I just want to say a quick word about the sponsor. Again, welcome to the You and Your Doctor Living a Longer and Healthier show, sponsored by All County Healthcare, a Medicare-certified home health agency. I'm David, your host for this evening. You can listen to us every Tuesday right here, 6 to 7 p.m. on 95.3 FM and 1470 AM. And also now on Fridays, 5:30 to 6 p.m. as well. Every Friday. So I kind of do it like 3 shows a week. I do 30 minutes on Friday, and I normally split the 6 to 7 tonight into 2 30-minute segments as well. If you have any questions about Medicare or Medicare certified agency or home health care, you can call Maddie, and she'll be happy to answer your questions at 1-888-717-7170. So over the last 2 years of doing this show, so much has changed in the medical landscape. And one of those things is robotic surgery, which I know the listeners and viewers have heard us talk a little bit about. And then as well, and we've talked to a few general surgeons, but I don't think we've had a general surgeon on the show with the amount of expertise in a robotic surgery as our guest tonight, Dr. Romane Joseph. He's a general surgeon in minimally invasive surgery, so that's always good news. Anything minimally invasive with surgery has got to be good news, with North Shore Medical Center in Miami. And he was nice enough to drive all the way down to the studio. Thank you, Dr. Joseph, for joining us. I don't get a lot of doctors in the studio from Miami, but we're on all over South Florida, so thanks for making the drive. I really appreciate it.
You're welcome. You're welcome. It's a pleasure. I really appreciate the invitation.
And it's nice meeting you in person. We talked a few times by phone. You're very pleasant on the phone, so that's already one notch in your belt with the listeners and viewers. Great-looking man as well. I got to say that. I mean, you're a very friendly...
Thank you.
Very friendliness to you, so I like that.
I appreciate it.
And perfect lab coat, perfect white. I'm painting the picture for the radio listeners. Do you have a tie-in to Boca Raton? Do you live up here this way?
I live in Pembroke Pines.
Oh, okay.
So
but you wanted to be in studio.
Yes,
Thank you.
No problem.
My
pleasure. My pleasure.
I love Pembroke Pines. There's so much going on there, but we'll get to that a little later in the program. So we've had a few doctors on from North Shore. I've had a neurologist on the program and a few others, but I don't think any the general surgeons. And the reason I really wanted to have you on is to talk to us a little bit about general surgery, but also about this robotic surgery you're doing there. Is it the Da Vinci?
The Da Vinci robot, yes.
Robotic surgical system. So I've had a couple doctors on talk about the Da Vinci. Now there is the traditional Da Vinci, and now there's a Da Vinci X.
Yes, we keep improving. It's a system that keeps improving, like everything in life. The way I try to talk to my patients and explain it to them, it's a couple of years ago we had the big TV with a big box, and then now we have the flat screen, and then now they change the flat screen into a curved one. So time is passing. The same thing is happening to the surgical technology, to that field. We had the robot, it was big, and then now it's shrinking. Now you can do the surgery into just one port, one little hole. So it's really quickly changing.
And that's for the good, right?
Definitely.
Yeah, you were mentioning the TV that I had. That TV, it's like the 2000 Super Bowl was 61 inches, and it was a projection box.
That's
and it was so heavy and so big. And now, like, I just thinking in my mind, what I have now is that little Samsung thing hangs on the wall, and it's got a little curve to it.
Very thin.
That's a good way of explaining that.
That's the
how
same
much
thing with
changed.
surgery. We used to make a big incision from up all the way down. Now we don't do this anymore.
No, because of the robot.
Because of the robot.
Well, let's get into it right away with the robot then. So I've actually had the chance to demo a demo robot of the Da Vinci. Obviously not the one you're working on, but I know Da Vinci goes around, drives it around to different hospitals. And actually another tenant hospital, Good Samaritan Medical Center up in West Palm Beach had it. And I waited in line for a while, but I got into that console, and I never got it until I actually got in there and was in there and started playing. And they had this little rubber band, then you moved it on. It looked like a piece of tissue.
Yes.
Maybe you've seen this demo. And then you slid it on there. But it was amazing, the actual precision. I imagine someone with hands like yours who have done traditional general surgery and then go into that, once you get it, it's like
amazing. I mean, it's hard to explain to our viewers unless they can actually see it. It's hard to explain what the system is like. I remember when I first started, I used to say, oh, don't worry. Listen, I can do the same surgery through a very small incision. I don't need to use the robot to do it because my incision open surgery used to be very small. And then they say, well, I'll give it a try. And just the day I tried it, I was impressed. I was impressed, and I kept on going. And now I can't even think about doing it without the robot. It's like, and the same thing to go back to the TV example that we gave. If you have a flat screen that's curved, HD, and then they ask you to move back to the box, the big box that we have, you as soon as you turn it on, you'll be like, really?
I'm not watching the Super Bowl on that thing again.
and it's the same feeling when once you get on the robot, you can't go back.
Oh, that's a good way of putting it. And like I said, I've seen it in motion. And now explain to us a little. I don't know if radio and video listener and viewers can actually get this, but you're actually in a console, and the patient is a good 20 feet away, maybe.
Yeah.
I mean, I know you oversee and you oversee the laparoscope going in, laparoscope, I should say. But you're actually in a console away from the patient when you're doing the surgery. Is that correct?
Definitely, and that's what makes it interesting, and is the fact that before we used to, when you do laparoscope, you're next to the patient, and you're actually doing the movement on the patient. Now with the robot, you have a little house, basically. It's like a little console. You just sit in it, you enter in it. To our viewers, it's like you actually go inside that area and then put your fingers inside the machine, and whatever motion that you make with your hands, and then it's being replicated inside the patient. So it's like you have try to think of it, it's you inside the room, and you're moving things around. So with the robot, you're inside the patient. You have the ability to feel like you're not necessarily inside, but you feel like you're inside the patient to do the same surgery that you used to open to do. Now you can see the blood vessels right in front of you and move them aside, do different things a lot clearer than you used to be to do before.
That's great news. And I want to ask you also, I've actually attended 2 Da Vinci surgeries. I had the lucky, actually when I was a reporter before I even worked for a hospital system. But one of the things that I think you're going to tell me here is that because of the way the robot is able to gets better angles than you would be able to get, I guess, laparoscopically.
Exactly.
So you're able to get to angles and what do you call it, surgeon margins, right? Is that what you call it?
Yes.
See, I did a little research.
Here's how to explain it to everybody. It's like if you try to eat spaghetti with the little baguette that we used to eat sushi with.
Oh, yeah.
So you're trying to eat sushi, and if you think of it, the baguette is just straight down, and you just, of course, if you do it enough, you're very comfortable at doing it.
Mm-hmm.
But think of it that you remove those baguettes and you just take your hand.
Yeah.
And this is what the robot allows us to do. It's like instead of using those instruments, a fork or something that you're holding to do it, you just use your hand to actually do it. So you can actually turn it whichever way you want inside the patient. If you think of someone like me, my hand would not fit in certain areas. With the robot, you'll be able to go down and in any little area, little holes, and see and clearly see and do movement and turn things around. So amazing.
That is great news. I'm just going to, again, paint the picture for our listeners maybe driving around South Florida. Dr. Romane, he's Dr. Romane Joseph. He's very in shape. He does have big hands. I will tell you that because he just told us that about the surgery, but but you are in shape. I don't want to paint like you're the size of an NFL offensive lineman or anything. But and he is in studio, and we're talking robotic surgery here this evening. Dr. Romane Joseph is on staff at North Shore Medical Center in Miami. It's about an hour from the Boca Raton studio, but we really broadcast from Miami to the Treasure Coast. So and you may have had this happen. A lot of people, when they have an ailment, they're searching online,
yes,
and they kind of decide nowadays what kind of hospital they're going to go to, or what surgeon even. Maybe they watch a video. I watched a video of you on YouTube being interviewed by... No, that's how I got to know you, though. I mean, that's how we're looking at it. That's the first thing we do nowadays is we go online and... Google, we Google your name.
Google Joseph.
Because I think you saw in the emails I sent you, I first time I called you Dr. Rohan, then I called you Dr. Romane, like the lettuce, and then finally I got it right. Because I went on North Shore's page and I was able to look you up. You can look up all the physicians on the hospital pages. So what I was getting to is, though, people are making decisions online, and you never know. You may have someone hear us on the radio or YouTube, or we're on Facebook Live right now. I mean, there's so many different avenues, and maybe a person schedules a surgery just because it's less invasive robot, Absolutely. So that's what we're going to talk about tonight. Excellent. And we have about 2 minutes until our first commercial break, but I want to let people know we're going to have Dr. Joseph here. The call-in number is 1-888-565-1470. If you have any questions and they're appropriate, I will get them in front of the doctor. Remember, he doesn't have your images and your X-rays and all that to go by, so he's just going to talk to you about possibilities.
Yes.
And what he can offer you. And also, I see you watching on Facebook Live. I see we have viewers there. So if you have any questions, All County Healthcare's Facebook Live page, just type in, be brief, and I'll try to get it in front of the doctor this evening as well. Now, Dr. Joseph, what is the most common robotic surgery you're doing right now in present tense?
The most common one that we do is hernia surgeries.
Oh, hernias. Wow.
With the robot, we're about to close the defect. The hernia is, for our listeners, the hernia is just a hole, basically. And you can have that either in your navel, somewhere in the on the belly, or in the groin area. So a hernia is a hole, and through that hole, something inside you will go through and create a lump that you see. That's the way most people really find out that they have a hernia. They have a little lump or bump that suddenly appears in the groin area, or they start having pain. With the robot now, we're able to fix that hernia, close the hole, and patch it through a very small incision. And before, we used to cut the skin. We used to cut from the belly button. If we're doing a umbilical hernia, we call it. If you're doing a ventral, we call it, we cut it on top or in the groin area. We don't do that anymore. Now, after the surgery, you can barely see where you were cut. And that's what I want our listeners and our viewers to clearly understand. Nowadays, we don't cut to do those surgeries. We make very small holes where we can do the same type of surgeries we used to do in the past, but through a very small holes that allows you to we go back to your activities a lot faster, a lot sooner, and with less pain.
And back to the beach and put the bathing suit on. South Florida, we're here. Definitely. Dr. Joseph, hold that thought. We're going to take our first commercial break, and on the other side, talk a little bit more about general surgery, minimally invasive surgery, and robotic surgery on the You and Your Doctor show.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor, Living a Longer and Healthier show. Tuesdays here 6 to 7 on the radio, and also on YouTube and Facebook Live. Check out allcountyhealthcare.com. You get all the radio shows there, or you can check us out on their Facebook Live page. Again, All County Healthcare INC. Type that in, and you'll be able to see Dr. Joseph and I right here in the studio in Boca Raton. So Dr. Joseph is on staff at North Shore Medical Center in Miami, where he does general surgery, robotic surgery, of course, minimally invasive surgery. That encompasses both. And then also has his own practice, Joseph Surgery, now in Broward County. So just really like on a good traffic day, about 30 minutes from here, maybe a day like today, 45. But that's not far in South Florida. You are at 4900 West Oakland Park Boulevard, Suite 107 in Fort Lauderdale, 33313.
Yes.
That must be near Florida Medical Center.
That's on the campus of Florida Medical Center.
Oh, wow. We've had a lot of doctors on from there.
Yes.
And Florida Medical Center is kind of like the brother hospital of North Shore?
North Shore, yes.
In a way? Because it says Florida Medical Center, comma, a campus in North Shore.
Exactly.
Are you on staff there as well?
Yes.
Oh, I didn't know that.
Yes, I am. Yeah.
Small world. Wow. 2 great tenant hospitals. So North Shore Medical Center, I'll tell the listeners, the easiest hospital to get in and out of. You just go on 95 South to 95th Street. Exit.
95 to 95.
Yeah, 95. Never thought of that. You could have your own radio show. You don't need me. I'll just walk out of here. No, 95 to 95, and what is it, like a mile off the interstate, maybe?
Yes.
If that.
Not
east.
Not even. Yes. A mile
East or west?
West.
West.
Yes.
I always think it's east. It's west. Okay.
Like 3 blocks down.
And
2 to 3 blocks down.
A hospital with a lot of history in South Florida. I actually worked with a woman, and her grandfather was the first doctor at North Shore, Dr. John Hilsenbeck.
Wow.
So, yeah, I know that history, so that's pretty neat. And she's a little younger than me, so yeah, I think the North Shore has been around a long time. I know the great history as well. So I could babble on forever, but let's get back into robotic surgery. How long have you been working with the Da Vinci robotic surgical system?
Several years now.
Several years?
As the years keeps going, keep passing you by, you don't even want. Now I'm having grays, so I try not to even think of it. Too many years.
Everything's moving so fast nowadays. But in the medical landscape, that's great, though, because you were mentioning these surgeries you used to do, like the incisions, and now you're doing surgeries and the people can wear bathing suits within
definitely.
No time.
Now, even with the robots, I mean, to try to paint it to our viewers, the robot has several arms. It's almost like an octopus, but just 4 arms. You put 4 holes inside the patient. But imagine now we do the same type of surgery we used to do with the robot through 1 hole. So you make the 1 incision in the navel, in the belly button.
Mm-hmm.
You put the instruments there, you do all the surgeries through that 1 hole.
Unbelievable.
So by the time when you're done with the surgery, patient, you can barely see where you had the surgery.
Yeah. Do you have a hard time finding something?
When people said, I just had this hernia repair, the gallbladder removed, and you start looking on the belly to see where they were cut. But nowadays, you can barely see those.
And talk to us a little bit about this this 4-pronged robot. What's on the end of there? What kind of tools do you have?
All the instruments that we actually use to do open surgery, the scissors, bovies, graspers, multiple things that we use to do open surgeries. Now we have those instruments to do the robotic surgeries. So it's pretty much everything that you need. You have available, and that's what makes it interesting. Is that this is developing so fast. This is going so fast that we're having more and more instruments that you don't even have to use open, and you can have all those instruments to do them with the robot.
And obviously, doctors are designing these robots, so that's great, as well. And you mentioned those claspers. That's what I used in the demo to put the rubber band on that tissue.
Exactly.
As well. And then we picked up, a lot of people remember this from when I was younger. We used to play with jacks as a kid, and that little spike. You've done that demo too? Yeah, that we had to do something with that as well. That was like round 2. And they timed us in 30 seconds how many jacks you could pick up and put into the little cups. So it's really neat having you here because I've actually used the Da Vinci. So
it's a lot of fun. I mean, doing surgery is something that I love. Doing surgery with the robot, forget about it.
Yeah, that's awesome.
It's crazy, especially in this generation where the children actually spend a lot of time playing video games. And I tell my son all the time that it's like playing video game. It's just that there's no game over restart because it's someone's life that you're operating on, you're dealing with. But it's basically like playing video game all day long.
Unbelievable. I can't believe that we're talking about robotic surgery in our lifetimes. It's really awesome. It really is. I wanted to ask you, how long are these type of surgeries like that you're using the robot? Say like a complex hernia to maybe an easy hernia?
That's a good question, because people ask me that all the time, how long the surgery is going to be. All I can say is varies from one patient to another, one hernia to another. My answer is usually, I don't know, because everybody's different. And the goal for me is not to rush with a patient and finish and do the next one, is taking the time to make sure it's done well. So that varies. Normally it can take 30 minutes. It can take 2 hours. It all depends. But the goal is to do it well. So it's not how fast we do it especially with the robot. It is faster. At the beginning, there's a time that you take to really get it and understand how it works. But once you get it, it's smooth sailing. I mean, there's no bleeding. Everything is in front of you. You can easily move this aside to get what you need. So it makes it a lot easier to do the surgeries.
And I can tell just being around you, I actually am good at reading people, that you're very calm, you're very collected, and you take your time and you're patient, and then you just made that point, and I was just thinking in my mind, that's all you've been since I've talked to you the last week, emailed with you, and you sat here like, I really get it. You know, and you said something that I wrote down, you were telling your son, it is kind of like a video game, but except that this is someone's life. There is no reset button. And to take the time to just explain in that way, I think that is amazing. If I had to have, gosh forbid, if I had to have a general surgery, I would want to have it with a doctor like you who's going to take the time in the operating room to make the best decision based on your, education, training, and experience on this Da Vinci machine as well. Robot. We're gonna call it Robot. Okay. My cousin in London, Miranda DePino, is actually watching the program. So we do have listeners and viewers in London.
Wow.
Hello. We did that.
Hello,
he said
London.
hi, Miranda. She said great interview, cuz I just saw it on Facebook. Hey, if you have any questions, we're lucky enough we're gonna have Dr. Romane Joseph here the whole hour until 7:00. Talking general surgery, minimally invasive surgery, and robotic surgery. So, like I said before, if you have any questions, type them into Facebook Live, make them appropriate, or call 1-888-565-1470, and I'll try to get in front of Dr. Joseph. Just remember, he doesn't have your X-rays or anything, so we'll talk about the possibilities of what can be done with those kind of ailments. And I'm all over the place here on Facebook and everything, Dr. Joseph. But that's okay. Again, at North Shore Medical Center in Miami. And then also, you have your own practice, Joseph Surgery. So that's Miami Shores. I like to visit Miami, but I couldn't tell you where North Miami versus Miami Shores is. Where are you in Miami Shores?
I'm actually right off of 95th.
Okay.
But the opposite direction.
East.
So North Shore is west, and my office is east.
That's where Miami Shores.
95.
Okay. Nice. So you're close to the ocean, your office.
I am close to Biscayne Boulevard.
Okay,
right
and
there.
that really, from Boca Raton, what is it on a good traffic day? An hour, if that?
About 45 minutes.
Oh, 45 minutes, not even an hour.
Not 45 minutes.
And so Dr. Joseph's offices are 9415 Northeast 6th Avenue in Miami, which is right near North Shore Medical Center in Miami, the hospital. He's on staff there in Miami-Dade County. And then Broward, 4900 West Oakland Park Boulevard, Suite 107, Fort Lauderdale. Everyone's heard me give out that address because that is where Florida Medical Center is right there. Yes. And you're right there on the campus. And that's a great hospital as well. We actually had the CEO from Florida Medical Center in the studio here, Trey Abshire.
Yes.
December 5th.
Excellent.
Great interview.
Excellent.
So he actually gave us a board member to interview last month, so we really love having them on. But we've had a lot of your colleagues at North Shore call in, so never had anyone drive from North Shore. So I'm like just amazed that I have you in the studio. This is fantastic as well. And I see on the back of your card, you have your areas of interest or what you specialize in. That's very helpful. We already talked about hernia repair. Breast surgery. Now, breast surgery is something you can do with the robot?
No, we have not done that. However, what I try to tell my patient, or I explain to them all the time, is the incision, just like everything in surgery, the incision, as far as breast surgery is concerned, is getting smaller and smaller.
Okay.
There are many things that we used to have, and you have to remove the breast. Back in the days, someone with a cancer or something like that. But nowadays, we don't. Nowadays, we save the breast. We remove through a very small incision. We're able to remove the mass and take care of everything. Breast biopsies, for example. If someone needs a breast biopsy, that's something that used to take several hours to do. Now we do that during the lunchtime. So if someone needs a breast biopsy, they don't even need to take the day off from work. During lunchtime hours, they pass by. It takes 30 minutes, 20 to 30 minutes to do. Lunchtime, you go back right back to work. You can barely see where you had the biopsy done.
That's amazing. Dr. Joseph, hold that thought. We're going to take another break, and on the other side, talk a little about skin surgery and some of the other things you're doing with the robot, gallbladder, thyroid, and intestinal surgery on the You and Your Doctor show. Well, I have
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back on the You and Your Doctor show, living a longer and healthier life, with Dr. Romane Joseph, General Surgery and Robotic Surgery, North Shore Medical Center in Miami, Florida Medical Center in Fort Lauderdale, which is a campus in North Shore, and then with offices in his practice offices, so his actual doctor's office in Broward and Dade County. 786-401-6455. I'll give out that information again, and or look on online as well, and we'll get you that info. So before the break, we were talking a little bit about breast surgery, and that's not you corrected me because I was wrong. That's not always done robotically, or not yet.
Not yet.
But that breast surgery is normally done for cancer.
For cancer.
Okay.
Well, for mass, if someone has a mass, something in the breast that's not supposed to be there,
okay,
then you test it by taking a small piece of it, see what it is. Once you know what it is, then you decide whether it's something that needs to come out, or you can leave it there and follow it.
Okay.
So those are the things that we also do.
Nice. And now it's not done robotically. You said not yet, but that's something that you think someday will be done robotically?
Definitely. I mean, I think that's the technology is going towards minimally invasive in everything. Because now they do heart surgery, neurosurgery with the robot. So it's something that we didn't think we were going to get there, not in my time, but we're already there. So I'm pretty sure that every surgery will be done eventually using minimally invasive.
Yeah, it just has to be introduced, and the approvals have to be done and whatnot. And
it's for the best. Yeah. You know, it helps. You make, instead of making the big incision, you make a small one. You're able to go back to work. Patients are able to go back to work a lot faster, less pain, no blood loss. So definitely the best way to go.
That's what I read on the North Shore Medical Center website, is less blood loss. I never thought of it like that. I always thought, minimal scarring was the first thing I thought about. Minimally invasive, I get, okay, you're making a smaller cut to go in, but lower blood loss, that's very important.
Definitely.
As well.
Definitely.
And then when you're making a smaller incision, less chance for infection, right?
Definitely.
Yeah.
I mean, the blood loss part is very important to us. Because you reduce the risk of infection, everything else by using since you can see all the vessels, you can see everything very clearly. So you just need the time to move things away, so you can do what you need to do without actually cutting and getting through vessels. So. And
then also shorter hospital stays. So the longer time you're in the hospital, hospitals are very clean, but there's still a chance, an infection. They're kept very cold, but the shorter time that you're in there, the less chance for infection, obviously.
Well, listen, I tell my patients that all the time. It's like, this is why I went into that field, is because you get to take care of something, take care of someone's, their relative, a family member, their lives, and you do it fast without stay in the hospital, without them staying in the hospital, back to their families and to regular activities a lot sooner. So
back to that quality of life.
That's it.
That we're living in South Florida. I know you have a great quality of life because you're a very happy man. So, and let me just tell you
what I do. I can tell. I can do it all day long. I just love it.
And Dr. Joseph can dress. I mean, I was talking to him during the break. He's got a brush off on me because I don't know what's going on right here, but he's got a very nice tie. Everything's pressed perfect. The lab coat is clean, which is important as well. I mean, like GQ, general surgeon right here. So that is fantastic as well.
Thank you.
So we gotta get you your own show. You don't even need me here again as well. And good laugh too. That's always important too. I don't have that great of a laugh, but you gotta. Well, I shouldn't say it medical, but you got an infectious laugh. It's like
Oh, thank you. That's good to know.
Yeah, we don't want anyone to get infection though, for sure. So, let's talk a little bit about, I'm just going right off your card. This is great. It's like I have all my research right here. Skin surgery. Now, this is something I've learned a ton about in the last 5 years. I grew up listening to reggae music. I'm from Jupiter, Florida, and I knew Bob Marley had passed away from cancer, but until I was older and actually read a lot, he actually had melanoma under his toenail. I always thought he broke his toe playing soccer and got the cancer then, and I thought maybe because of the marijuana use and with the Rastafarianism, maybe that had something, but no, it was actually melanoma under his toenail.
Yes.
And I've talked to a couple surgeons. I had a colleague in TV. He actually got driver's side melanoma from driving to work the same way every day. He didn't have his windows tinted, and he get the sun rays,
yes.
and he got it on his face.
Oh, yes.
Unfortunately, and they took a lot of it of his cheek skin off, but he was able to beat it, and it was rough. I remember he's a colleague of mine, so I remember him going through it, and he looks great today. I mean, I guess maybe a plastic surgeon was brought in after
to take care of
and he looks things. I don't even think you can tell, to be honest with you, if I didn't know the story. But he got driver's side melanoma. So talk to me a little bit about a skin surgery. So a general surgeon sees people for these types of...
Definitely.
Wow.
I mean, we do any lumps and bumps, lipomas, melanomas, like you said, all type of skin surgeries. Especially living here in South Florida, we have to acknowledge the fact that we're still under the sun as much as we love it. But it still might cause problems. So
definitely,
any type of skin issues we try to take. I mean, the way we summarize it is minimally invasive. Pretty much everything every surgery that's done, we do that by using minimally invasive approaches.
Okay.
So we can remove the skin, the lesion on the skin, and the same way they used to make a big incision, we'll do the same procedure but through a very small incision.
Oh, that's good to know. And then can you also do some things in office like cyst removal, sebaceous cysts?
Yes. And this is the great part, is a lot of the things that we used to take patients to the hospital for, we don't anymore. A biopsy, a skin biopsy, a breast biopsy. Like I said, the breast biopsy, we do that during our patients' lunchtime. Many procedures, we do that in the office.
And then going back to skin again, I had to ask you because I actually once had a sebaceous cyst on my back, and I had it for years. And my primary care said, you don't have to get it removed, but if you ever take your shirt off, I see how big it is, and it got pretty big, and it was hard, and every once in a while it would get a little tender kind of. So I actually had it removed in a general surgeon's office, and I was talking about Good Samaritan Medical Center over there on the campus there, and it was the easiest procedure. I laid down flat on my back. I didn't feel a thing.
That's it.
And yeah, it was actually a great experience. To be honest with you,
very quick. It is very quick. And I tell people, remove it before it gets bigger, and because most of the time they're gonna keep growing. And we know once they reach that size, yes, it's gonna be a bigger cut. So once we see it and we follow it over a period of time, we know it's not going away. Let's remove it.
Oh, that's good to know.
Because it's really fast to remove, and you know that you're not going to deal with that later on.
Yeah, and I actually got to see it. Okay, we have a caller on the line. So, Jake, welcome to the You and Your Doctor Living a Longer and Healthier Life show. Do you have a question for Dr. Joseph?
Yes, I do. I was just curious, how long does it take somebody to be trained in using the Vinci robotic surgery machine, and how do you actually have hands-on skills? Do you work on an actual patient, or do you work on other devices through your training?
Were you able to hear that, Dr. Joseph? I can kind of paraphrase.
Part of it.
Okay, the question Jake has is, how long does it take someone to train on the Da Vinci, and then are you actually training on a person when you're proctoring with the other doctor, or is it like a mannequin or dummy? Not dummy, I shouldn't say that.
Excellent questions. How many cases that we have to do, it varies. You have to definitely practice. How long does it take? The more you do, the better you get at it, until you reach a plateau. And I tell my patients and my students also that even when you feel comfortable, you do it as if it's your first one. So it's like pretty much like driving. You can drive all day long. If you feel too comfortable and you start not paying attention, you get into an accident. So it's the same thing with surgeries. You can do hundreds and hundreds of them. The day you feel too comfortable, that's when something happens. So you do it as if it's your first one every time, putting 2 hands on the wheel as you're driving, your seat belt and so forth. You do the same thing with your surgeries. We do the same thing with the surgeries. We do them very carefully, taking the time to make sure that everything goes right. As far as how do we, at the beginning, it's like learning to do surgery. You start by going to the lab, like you were doing the moving things around.
Oh yeah.
So that's the way. That's the way you actually start, by moving things around to feel it, to have a feel for it, what it takes to go from one place to another. Move something, how to grab it, how to move it along the way. So you start with a dry lab, we call it.
Okay.
Before you move into an animal lab. Once you've done that and you actually master the procedures, master the moves and everything else, then you do your case with a proctor. It's like you're driving. There are 2 consoles as you're driving, learning to drive. The teacher, the person driving with you, has brakes and so forth. So the person next to you has the same things, telling you, okay, giving you advice on moves to make and what makes it better. So over time, you start developing your own style doing it, but you had someone there with you so you can be safe for the patients.
I was always wondering that. Jake,
that was an excellent question.
Yeah, that was an excellent question. I got to tell you, it was an even better answer because you went above and beyond and hit it out of the park and explaining it. Do you have any other questions, Jake?
No, that was very interesting. I appreciate it, Dr. Joseph.
My pleasure.
And Jake, you can find Dr. Joseph in Broward County, 4900 West Oakland Park Boulevard, Suite 107 in Fort Lauderdale. That's right on the campus of Florida Medical Center. You've heard all the doctors we've had on the show from there. And then in Dade County, only 45 minutes from here, 9415, so 9415 Northeast 6th Avenue in Miami, just east of North Shore Medical Center, the hospital that is on staff in Miami as well. 786-401-6455 is his number. Hey, Jake, thanks for calling in. Call back and we'll have your prize for you, okay? I think he's gone. But anyways, I think he hung up. I always wanted to be a disc jockey, and that was That was a little far-fetched there. But we have another person online that said, Daisy Cedeno says, great job. This is a very interesting interview. So we're getting a lot of Facebook tonight. They definitely like you, Dr. Joseph. We may have to get your own Facebook Live channel if you don't have it already. I know you got a lot going on, so I won't go there. I was actually watching a show on TV and about doctors, and I was trying to learn a little bit about proctoring, so I'm glad that you took the time to explain that, because I don't think we ever get to hear from a doctor, how it actually works, and especially with the robot. During your general surgery training, did you also do like a more of like a theater training where like the doctor would be doing a surgery and then the residents are kind of around, like I've seen on a couple TV shows? I know we all watch on TV and it's a lot different in real life. But
there's a lot of truth to it. You start as an intern. As an intern, you just observe. You scrub, you close by, you help by holding things, but during the procedure, you're actually being taught, this is what the vessel, this is what to do, this is how to move it. As a second year, then you start doing more, having more responsibilities. So that's why it takes so long before you can actually master those skills. Many years and many procedures. But like my teachers used to tell me, don't forget, every time do it as if it's your first one. So you need to feel it. You still need to have your heart racing to feel that stress, because it's someone's life that's in your hand. You need to respect that at every time.
Oh, that's great. And tell us where you trained at, where you did your education and training.
I did my medical school in New Jersey at Robert Wood Johnson, UMDNJ, Robert Wood Johnson in Piscataway, New Jersey. And my surgical training at Brookdale Hospital in New York. So hello, Brookdale.
Hello, Brookdale. Was that Brooklyn?
In Brooklyn.
Well, you were saying East Brooklyn, right?
East Brooklyn.
Wow. Boy, you must have seen everything in New York City. As a general surgeon, the amount that you must have seen and trained, that has got to be the best training in the world.
This is the place to be. The place to be. You'll see a lot. You see, it's like someone spending many years right there at the trauma center in Miami.
Okay.
But the entire surgical training is right there. So
wow.
It's you see a lot.
And you were telling me that at one time you wanted to be a trauma surgeon, right?
Yes.
Not anymore.
Not anymore. You see, it's interesting, but also sad in many ways. And once you have someone come, when a patient comes to you and you're not able to save them, it really a big toll on you. And you have people coming with multiple gunshot wounds. There's some, there's not a lot that you can do. You do the best you can, but every time that happens, it's a load.
Yeah, unfortunately, that's part of our society right now, but we're going to make it better. But we're lucky to have you as a doctor in our society. I'll say that. Now, this is gallbladder surgery. It seems like something more common. I know it seems like women have it more than men. Do you see more women having it?
Definitely.
Why?
Hormones.
Hormones?
Multiple issues. But definitely more women than men. And it's one of the most common surgeries that we do in the United States. It's very common. It's something that we do every day. And I tell people that since it's something that we do so often, the tendency is to take it lightly. But it's one of those surgeries that you really have to respect, because there's so many things that can go wrong.
Oh,
you have to really respect it. And I usually say it's like driving. You drive every day, you leave your house and drive every day. But if you think of so many things that can happen in 2 blocks radius, you would not drive. The same thing with gallbladder surgery. It's one of those things we do all day long, but it's something to really pay attention to.
That's a good point, because I don't know if this is true, but I've heard that most people have accidents within 5 minutes where they live. So if you really knew the chances of a bad accident, maybe you wouldn't take that drive. And Like we're doing gallbladder surgery.
Leaving home or going home. Yes.
Wow. Are you doing that robotically, the gallbladder surgery?
Robotically.
Oh, that's great to hear.
There's people with gallstones, people that said they start having pain on the right side. They usually think it's gas. They think it's gas, and you have pain, and then you go to the doctor. They do an ultrasound. They say you have gallstone, one hole, and then we remove it.
Wow. And that's, as a general surgeon, that's the one that people are knocking down your door when they have that pain. That please let me have surgery, because that, I've seen someone go through it, and that pain threshold is very high with the gallbladder.
It is.
With those gallstones and those spikes.
It is.
Yeah, they must bang down your door when, how soon can I have surgery?
People say all the time it's worse than having a child.
Wow.
Giving birth.
We've heard that.
Really, yes.
Wow, really, I don't know how the body, the pain threshold that some women go through is just. Women are amazing. I'm just going to say that a thousand times.
And listen, that's probably why men can't have it. Because,
we can't deal with it.
We can't
That's
handle
a good point.
I know I can't.
No way.
I'm a big baby. I tell people that, my patients that all the time. So that's why I understand and give them pain medication, take care of them, because I can't deal with pain.
Yeah, it's I can't either. So now thyroid surgery, that's something I hadn't heard about until just recently, I guess, with thyroid cancer, the chance of getting it. Now, that's something that, correct me if I'm wrong, that's not done robotically, right?
No, it's not.
Okay.
Those are the type of surgeries that I say eventually we'll be doing. Can we do it? I'm sure that people are trying, and eventually that's going to be done. But now most people do it open.
Okay.
Most people do that open.
And let me just mention, these are all surgeries that Dr. Romane Joseph does. I'm reading them right off his card. We're going one by one. And I actually, my mom had the thyroid surgery, and not bad. It's a cut in the neck, but you can't even see it. I don't know how you're able to, with the fold, or how you do that.
Yes.
Hide the skin.
Hide the incision through the folds of the skin.
Wow.
Yes. That's, especially being here in South Florida, it's important how the patient looks.
The look.
So the look, make sure that whatever surgery you're doing, you make sure the incision is nice and you can barely see the cut. And this is why we emphasize the fact that we do most surgeries now with minimally invasive. So we make a small cut. Remember, the skin is elastic. You can actually spread it.
I never thought of it like that.
So by making a small incision, you can actually...
it's like a rubber band.
Exactly.
Huh.
So you don't need to cut. You don't need to cut anymore.
That's great news. And intestinal surgery. Now I know that's very important, because if you have a problem with your intestines, you can actually pass away from it.
Unfortunately.
Yeah.
Yes. And this is where the robot helps.
The robot. Okay. This is back to robotics.
Back to robotics. This is now we're able to do the intestine surgery, colon surgery. If someone has a bleeding or a mass, cancer in the colon, we're able to remove that through the same small incision that we talked about. While back in the days, you used to have that big cut to have the surgery. Nowadays, no more.
Nice, because of the robot.
Because of the robot. And the robot allows you to get very close to what you're doing to the colon that you need to remove, especially down in the pelvis, where it was always difficult to reach. Now with the robot, it's
with that really, laparoscope trying to.
Now with the robot, is 1, 2, 3.
Now it's got to be easier on your physique too, because I've heard some surgeons say that with the laparoscope, sometimes there was surgeons getting shoulder injuries.
Pain, yes.
You've heard of that?
That's what the robot helps. Now you sit down and you're doing the surgery. Like I told my son, it's like playing games all day long.
Yeah. Well, we only have 2 more minutes, and we're here with Dr. Romane Joseph. I'm going to go like a lightning round here. Stomach surgery, I imagine that's bariatric surgery that you do?
All type of stomach surgeries, from bariatrics to removing a mass, someone that's bleeding in the stomach, any type of issue with the stomach. We're able to do those, also using laparoscopic or robotics system.
Now you do the sleeve
and sleeves
and the bypass?
No, I don't do the bypass.
Okay.
But there's bariatric surgeons that's just specialized in that type of surgery.
But you do the sleeve?
No, those two are bariatric reducing surgeries, bariatric surgeries. The bariatric surgeons are the one that do those.
I get.
But
now,
they can use the same robotic system to do those surgeries.
Nice to know. And the you do colorectal surgery as a general surgeon.
Yes,
so
definitely.
for colon cancer.
Colon cancer.
Is it March? Is Colorectal Cancer Awareness Month. Here we are. We got you in the studio. So that's great as well. And last but not least, hemorrhoid surgery, which can be very painful. And you're able to do that as well.
Hemorrhoid surgeries, we do some of them at the office. And if not, then we go to the hospital and we do the same. And that also has changed over time. People have less pain, quick surgeries nowadays.
Thank you, Dr. Romane Joseph. I really appreciate you making the drive. You're always welcome on the program. You know that.
Thank you.
With offices in Broward and Dade County, 786-401-6455. Call his office and talk to Dr. Joseph and his staff. Thank you for listening to You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.